Hi, I'm Chris Lombardozzi. I am an emergency medicine physician and medical director for Spartanburg Regional Hospital's emergency department. Today I'd like to talk to you about what to expect when you come to an emergency department. We have many different patients who come here, and in fact, last year we saw almost 100,000 patients in our emergency center. No matter what your problem, we're here for you 365 days a year, 7 days a week. When you come to our emergency department, you might come through one of two ways. You might walk in or come in with your friends or family through our front door, or you might come in by EMS. Either way, we're here to take care of you. So this is our front door, and you've just come through our revolving door and you've met one of our greeters. Our greeters are here to say hello, find out some basic information. Why did you come here to our emergency department and what can we do for you? They're going to ask you some very basic information, your name and your chief complaint. Following that, the greeter is going to pass you through our double doors. You've just passed through and entered our triage area. Our nurses in the triage area will see you, put you in a private room, take your vital signs, those are things like your pulse, your blood pressure, your oxygen level, and ask you a couple more questions. They'll ask you things like, are you having chest pain? Do you think you're having a stroke? Are you here because your stomach hurts? Depending on your type of problem, you may be placed immediately in a bed. I'll talk about that in a little while. We've got multiple different areas in our emergency department for you. Or you may be walked down to a different part of our department. You may be seeing someone in an urgent care area, perhaps a chest pain area. You may go to our major care area, our pediatric area, our women's area, or you may go to something called results waiting. Either way, we're placing you in a place that's best suited for your type of problem. One of the things you'd like to have happen to you when you come to an emergency department is to be seen as quickly as possible. After all, you're usually in pain, perhaps you're anxious about a particular problem that you may have, and you're worried. One of the things that we try to do to see you as soon as we possibly can is to have a doctor, a nurse practitioner, or a physician's assistant see you within the first 15 minutes that you arrive in our department. You may be seeing one of our nurse practitioners who will gather a more detailed history and initiate some early lab testing, perhaps x-rays or other things that you may need. Depending on why you came to the hospital, your care may be truly an emergency or it may be a little less urgent. Regardless, we try to put you in the best place that we can to care for you properly and in an expedient way. One of these areas is called results waiting. After you've been seen by our nurse practitioner or physician assistant out in the triage area, you may be walked to an area called results waiting. You'll notice the lounge chairs and not standard stretcher beds. We have normal, typical exam rooms for you to be seen so that you can have privacy and have conversation with your doctor and your nurses. But after that, for simple problems, and in order to get you through the emergency department as quickly as possible, we'll place you in these non-stretcher areas. We hope that this is a more comfortable area for you. There's TV, a bathroom, and you can have your family sit there with you. So after you've been placed in a care area and our doctors have seen you, you may be here for a short period of time for a simple problem, or you may be here for several hours while we evaluate you and take care of you. It all depends on what your problem is. Please understand that certain problems take a lot more time and a lot more testing to find out what your particular diagnosis is and what we need to do to help you. That's our goal. Our goal is to help you as much as we possibly can. Please be patient as you go through this process. You may find that you're asked the same questions a lot. That's for your safety and for our information to help us to help you. So it's been maybe a half an hour, maybe 3 hours, and your care process in the emergency department is already complete. At this point, you may need to be admitted to the hospital, perhaps for a medical reason or a surgical reason, or perhaps you're going home. If you're going home, you can expect us to talk to you about your diagnosis, about the types of medicines that you're going to be on, and the kind of follow-up that you're going to need when you leave here. Please listen carefully to these instructions, but also if you have questions, now is a great time to ask us. It's often confusing to hear medical terminology and words you don't understand. Please feel free to ask us what these mean so that we have an opportunity to explain it to you. If you're being admitted to the hospital, you can expect a surgeon or perhaps someone called a hospitalist to take care of you. In the old days, a family doctor would come into the hospital and see you and admit you and take care of you throughout your hospital stay. But now, specialized doctors called hospitalists will be seeing you and taking care of you while you're in the hospital. These doctors are responsible for your care here, but will also coordinate your care when you finally leave, and they'll talk and leave messages for your primary care doctor. While you're here in the emergency department, our goal is to provide the best possible care for you in a safe and clean environment. Please let us know if you have any questions at all. We're here to inform you. We're here to take care of you.